COVID-19 has been perceived as mainly a respiratory illness, attacking the lungs. But research is now showing 1/5 of patients are experiencing severe heart damage. More concerning, many of these patients have not had underlying heart problems before. A team at UT Health San Antonio trying to figure out why some people's hearts are affected and others aren't. Courtney Friedman breaks down this important study.
It's already been clear to scientists and doctors that people with underlying heart issues who get COVID-19 have poor recovery outcomes. But what about the people infected who have never had heart problems and suddenly develop them?
They had elevations of blood enzyme markers that were consistent with a heart attack, even though they didn't have any blockages in their coronary arteries. They had heart rhythm disturbances, and that this occurred with quite high prevalence.
UT Health San Antonio Chief of Cardiology, Dr. Alan Anderson, says 20, sometimes up to 30% of patients are displaying these reactions. So researchers there have set up a long-term study to find out why this is happening and how to possibly stop it.
We see patients who have likely had viral infections that they didn't even recognize, and yet they manifest with heart failure symptoms months or years later. So there could be a long-term implication to the health of patients who have been affected by COVID-19.
The study involves 2 drugs, one an antibiotic and the other a diabetes medication. Researchers believe both have the potential to block the virus from infecting heart cells. They're looking at isolated muscle cells in the lab right now, and if all goes well, they'll begin doing clinical trials with patients who have recovered from COVID-19. Depending on the outcome, they could track those patients for 10 to 15 years. For the 9, Courtney Friedman.
Dr. Anderson also said these patients are very prone to developing blood clots. He said that's been seen a lot in North America, blood clots in the legs, in the lungs, and possibly even in the smallest microscopic blood vessels. They're going to be studying that reaction as well.